Hi, my name is Eddie Low. I'm only 66 years old young. I have been working in the past in several multinational companies, but my last few years of work has been primarily as a church pastoral worker, mainly because it started with my diagnosis in 2017, diagnosed with lungs first and then liver subsequently in the same period, and then prostate. So I am a survivor in that sense with 3 primary cancers. I've been very much involved in family life work, promoting family life, strong values. So that's my volunteer work, not work, but volunteer in the church while I was working in the multinationals. So primarily I've always been involved in church work, helping to bring about building a strong family values. And the rest is all about some free time, enjoying life and making use of whatever I've earned to enjoy a bit of life, and at the same time balance it with a good value system. It was quite accidental when I was diagnosed. Firstly, through a normal medical checkup, and I had an X-ray, and the X-ray shows my lung had some image and suspicious, and thus I was advised to take a further medical check, and I went for a CT scan, and CT scan showed pretty much suspicious. It's lung cancer, and therefore a biopsy had to be done, and at the same time it took a snapshot of my liver at the same time, and when I was confirmed with having lung cancers early stage, I decided that before going for any lung treatment, I should take a look at my liver at the same time because it was suspicious, so that I can also take a look to how to treat both cancers, and both turned out to be primary. So it's very confusing. It's very it's very stressful, of course, and worries, fears, and all kinds of things goes up on your mind. Yeah, and.
You were with dental check.
It was an accident. Yeah.
So the regular check.
Yeah, just a regular medical check, Yeah. So that made me a bit bonkers in that sense, When you have 2 cancers that is not related, it's which one to do first, or should I do both at the same time, or should I go for chemo, should I go for surgery? And all this were all on my mind, and well, I had some good friends who are doctors that could help me along, but they would not be able to give me the solution to what I should decide for myself. Thus, I had quite a while to make decisions on that. And finally, with some, I would say faith-related, I decided to just go ahead to do the surgery, which was recommended at the same time. So I went on a lobectomy, and in terms of keyhole surgery for the lungs and liver at the same time. It took about 12 hours. It caused a lot of stress to my family as well. But I came out good. Hell, it's a journey, it's a roller coaster. Today, I still term myself going on a roller coaster ride. Sometimes the roller coaster is just pitched up there, waiting for it to come down. At this point in time, after 7 years, I'm still dealing with my liver cancer, several relapses over the years. Many different forms of treatment, from chemo to radiation to ablation, the whole slew of cancer treatment I've gone through. So it started with a early stage, but they went into third stage, stage 3, and advanced, and it's still under control in that sense. But anything can erupt because they are all 3 primary cancers. So it's like 3 persons having 1 cancer each, and you just throw the dice. So it's someone says that it's like whack-a-mole, you know. When it comes up, you bring it down. So I've been blessed, I've been lucky. So far, it's been quite a journey. Yeah, well, when I was diagnosed with lungs and liver, around the same time I was monitoring my PSA level for my prostate. So the level is out of the norm. So I should actually investigate further, but because the lungs and liver were more important organs, so I just parked my prostate investigation aside. Once I had my lungs and liver surgery done, I investigate further on my prostate, and from 1, 2, it became 3. And that has been very, very stressful. But I would say my faith helped me along. And of course, friends that supported, and my family, of course, is the main, my caregiver, and that helped a lot. I have a history in my family of cancers. My parents both died of cancers. I've got 5 siblings, 4 of us have cancer. My 3 other siblings went before me. My elder sister, my 2 older brothers, of breast cancer, of lung cancer, and kidney cancer. While I was diagnosed with my cancers, 2 of my other brothers were still around. 3 of us were having cancers. That's the kind of excitement there in the family. I can laugh it out now because I've learned from them also how they took on their journey, and I learned from that as well. So only my elder sister is cancer-free. From all this.
Do you have children?
I have 1 daughter. I have 1 daughter and 1 granddaughter, 4 years old. That probably gives me a bit of good moments. Good moments.
Your daughter can play, get sweet.
They are aware. I think early screening is always important, but when you talk about insurance, when friends ask me to go for genetic testing, I say make sure your children all have their insurance covered first. Because if you are diagnosed with that and your genetic that's linked, then you may not get coverage from the insurance. So get it covered before you start doing the genetic testing. Frankly, no one would want to go for such treatment. I think even sharing information about my own journey, I can sense people are not so, I'll say maybe, not happy, but they are not so pleased to hear, information that I share sometimes. But to me, it's to your benefit, but then it's to each his own. My support system basically, a lot has been self-help, self-motivated, the positive thinking that I have. My grounding on my faith helped me. Not giving up, knowing that I've been diagnosed. It's quite difficult if you're in the family when everyone had went through it, and 2 of my other brothers are already having it. It's very difficult to discuss further within the family and their children. So there's a limitation to it. But it does give me an insight on how they handle their treatment. So that helps to some extent. But primarily, the key driver for me has been that positive mind, the faith element that helps me. Because the emotional and mental stress from these 3 cancers has been, even till today, it's been sometimes quite challenging. I can wake up in the middle of the night and start thinking, what's happening, might as well take me, I don't want to go through this. So even right now, yesterday I went for a review with my oncologist, and the proposal is to do further either systemic treatment or ablation treatment. So I'm still deciding again. So throughout my 7 years, it has been this, there's always a crossroad every time I encounter a discovery. And till today, I'm going through the same thing again. So sometimes it can be very tiring, but I guess the moments of, I won't put it stress per se, but the purpose to go on living is important, and that's the reason why I'm willing to do such interviews to help others to overcome their journey. Part of my self-help journey has been always seeing what's available out there, and 365 Cancr Prevention Society has been one of the foremost organizations that I reach out for help. And they have given me counseling per se, although I may not really need counseling, but I thought, put aside that the pride and go for it, and it did help me. Besides that, they offer several support activities that actually benefited me, and with the encouragement to go for free screening, all that, I use that as a platform to share with my friends that, yeah, please, go for yourself. It's free after all, The cancer journey for me, has always been a gentle tap on my shoulder. It's a wake-up call. Personally, people will not agree with me. Many people may not agree with me. It's a blessing for me. It's a blessing for me because not many people get to prepare for their end. But I'm able to prepare for my ending. And but I can't say that to anybody that is just diagnosed with cancer, right? The journey is different for everyone. The type of cancers are different. The age group is different. My only advice is for them to find peace within themselves. Be positive, which is very difficult, So that's why I mentioned that faith element is very important, the spirituality of that person. Need not necessarily be a Christian, can be a Buddhist, can be any faith. As long as it's faith dimension where there's an element of peace that you can gather, that's very important. The element of being able to self-help, go reach out, to organizations that provide the support. Don't walk alone. That's the reason why I'm still wearing my cap, That's my "you never walk alone, never give up" attitude. This, if you Google the song, it's a commercial song, it's a pop song, but the song gives you hope. It gives me hope till today, and it's still giving me that hope. So my advice is basically be positive, don't walk alone, get support basically. But it's very difficult for people who are just diagnosed because they have to overcome the various stages of accepting it first, and etc. So in terms of the support that the hospitals, the clinics can provide, is to be able to point them to the right areas where they can get help. And 365 CPS is one of those that they can point out to, so that they won't get lost. I think many patients that newly diagnosed are lost, and so I feel very passionate that if I can help, I will help them along to overcome the fear, and to gain confidence that I'm going through it. I'm still going through it. So let's journey together. Yeah.